Namaste, good evening and welcome to today's session. I am Dr. Vikas Bordula, consultant orthopedic surgeon in Apollo Excel Care, Guwahati. So today we'll try to address some of the common problems with which a patient usually comes to an orthopedic. So one such situation is where an elderly lady comes with a history of diffuse aches and pains all over the body, especially over the back. Her attendants would often point out that she had lost her height the last few years, and also that she has started to assume a stooping forward kind of posture. So the most likely cause in such a scenario is osteoporosis. Now, osteoporosis is a condition where there's a reduction in the bone density as well as the bone quality, leading to the increased risk of fracture formation, fracture occurrence. Now, the bone is a dynamic structure. Any given point of time, some new bone is being laid down and some old bone is being reabsorbed. So much so that even the whole human skeleton get changed by about 7 to 10 years. Till the age of about 30 years, the process of bone formation takes precedence over the bone absorption. So by the age of 30 years, a person usually attains the peak bone mass. Beyond that period, the process of bone absorption takes precedence over bone formation, and thus the person starts to lose bone mass, albeit at a very small rate. And this happens irrespective of the gender. But what happens in women is that in addition to this age-related bone loss, there's another cause of bone loss, that is because of the hormonal imbalance that occurs during the perimenopausal period. And in fact, women can lose up to 30% of her bone mass 30% of the bone mass within a period of about 5 years. So this increases the risk of fracture occurrence diabolically. So, for example, if an elderly lady sustains a fracture of the hip, so the chances are that about 30 to 40% of those set of people are never going to be independent in their life ever again. So it's very important to identify those set of people who are at risk of developing osteoporosis or its related complications, so that timely intervention can be taken. So first thing to do would be to get a DEXA scan done. It's a very simple test. The radiation hazard is also not very high. It's about 1/10 of a chest X-ray. And what it does is it compares the density of the bone of the person and to that of a 16-year-old. And if your value is off the standard by a certain margin, then it is termed as osteoporosis. Uh, the population of women over the age of 50 years in India at present have about 40% of them have some degree of osteoporosis at the moment. So every woman over the age of 50 should get a DEXA scan done. And in case your DEXA scan shows your osteoporosis, and then medication should be started soon. A lot of medicines are available nowadays. Some are in oral formulation, some are in injectable form. And depending upon the clinical situation and the comorbidities, your clinician would prescribe you one of those, and this can be safely administered. But what is more important is to try and stop the occurrence of osteoporosis at all at the first place itself. That's a better idea. So some of the measures that can be taken to decrease the chances of osteoporosis occurring is number one, diet. Bone is made up of basically two things. One, there is a protein meshwork over which minerals are deposited. So you need a good amount of protein in diet, and it can come from sources like pulses, cereals, and dry fruits, etc. The calcium requirement per day is about 1000 milligram, be it from the dietary source or supplemental calcium. And some of the food that have good amount of calcium are milk, curd, cheese, and green leafy vegetables. For example, a cup of milk contains about 300 milligram of calcium. So if you take around 3 cups of milk a day, then your whole day calcium requirement is met through the milk only. But there are people who have problems with dairy products. So sometimes you do need to prescribe supplemental calciums. But given a choice, we will always prefer calcium from dietary source than supplemental calcium. Third is vitamin D requirement. There's about 1000 international units per day. And this can be obtained from exposing oneself to sunlight. What happens is that the ultraviolet radiation that accompanies the sunlight, it helps produce the active form of vitamin D, which in turn helps in the absorption of calcium from the gut. But for that, you need to be standing in the midday sun for about 45 minutes a day for around 5 days a week. So for professionals, it may not be possible to do so. It may be a practical idea. So better practical idea maybe to give an occasional supplement of vitamin D. Besides, some of the food which contain good amount of vitamin D are they're mainly animal sources like fish and egg. And if we need to give a supplemental vitamin D, then it's given in the form mainly in oral formulations, about 60,000 units weekly capsules for continue for around 6 to 8 weeks, and then continue once a month tablets. It can be continued for a long period of time. Toxicity doesn't really occur too much with the oral formulations. It is more associated with the injectable forms rather. And some of the things which should be avoided in osteoporosis are alcohol and smoking and soft and carbonated drinks. The second set of measure is the exercises. For example, if a bodybuilder lifts up an iron, the muscle will respond by increasing its girth. Similarly, when the muscle pulls on the bone also responds by laying down a new layer of bone. So weight-bearing exercises are very important to counter osteoporosis. But again, an elderly lady who is most likely candidate to have osteoporosis, it's a weight-bearing exercise may not be a reality. So even if she walks for about a half an hour a day for around 5 times a week, even that will take care to a large extent the ill effects of osteoporosis, because when the heel strikes the ground, even that sends a signal to the bone, which again responds by try to forming a new bone. And third is fall prevention. Well, almost all of the fractures that occur in osteoporosis are preceded by a fall. So preventing a fall also prevents a fracture. So osteoporosis per se may not be the problem, or the patient even may not know he has got osteoporosis. But what creates the problem is the fracture that occurs because of the osteoporosis. So if we can reduce the fall and reduce the fracture, we are achieving the ultimate goal of preventing the complication of osteoporosis, that is fracture. So some of the measures that can be taken to improve or reduce the fall is number one, improve the balance, because after the age of 60 years, a person usually starts to lose a sense of balance. So yoga can help in a big way. Another simple exercise is try to stand on a single leg and try to balance, and alternate with the other leg. And this can also go and help improve the balance. And there are some of the other measures that also helps in preventing fall, especially in cases where the elderly person lives alone in a house, is to light up the whole house and avoid wearing loose clothes, because they can get stuck somewhere and might fall off because of that. Then avoid carpets because the toes can get stuck at the edge. Avoid wearing socks in the winter, can get slippery, and try to attach railings on the wall, especially in the bathroom, so that in case he tends to fall, he can get something to hold on to. So with these measures of following a healthy lifestyle, good diet and exercises and fall prevention, a lot of the complications of osteoporosis can be minimized. So now we move on to another scenario. This time again, a lady in her 50s probably, um, coming with the complaints of knee pain, which would start with first one knee and then gradually go on and involve the other knee as well. So initially, the pain would come on after some activity like walking for a distance or climbing stairs, but that would go off after taking rest. But gradually, the pain would stay even at rest. She would also complain of hearing some sounds around the knee, and also that her knee had become stiff over a period of time. So again, the cause in this kind of scenario is most likely osteoarthritis of the knee joint. Now, um, the osteoarthritis is a degenerative disease of the joint, or a degenerative disorder of the joint rather than a disease. So, uh, the most important structure in a joint is a joint cartilage. The joint, what it does, it caps the ends of the bones that forms a joint, and it gives a cushioning effect. So what it also does is that it acts as a shock absorber, and as well as it allows for free gliding movement of the joint. But the problem with cartilage is that it doesn't have a significant blood supply. So whenever it gets injured, it cannot heal itself. So over the years, when these small injuries they accumulate, time may come that the whole of cartilage would just get eroded, exposing the underlying bone with its the free nerve endings, which can be painful. So this creates the symptoms. Now, diagnosis of osteoarthritis is not very difficult. Simple X-ray in a standing position is good enough to let us know if you have osteoarthritis or how far you have damaged the knee. No fancy investigations like MRI or so is required. But once you're diagnosed with osteoarthritis, it's important to know that this is a progressive disease and there is no cure as such. But the symptoms that occurs because of osteoarthritis can, of course, be treated and taken care of. Also, it's important to know that uh, the, uh, the vast majority of the patients are going to improve with physical therapy and rehabilitation alone. And it's a very tiny percentage of 5 to 10% patients who do not respond to this physical therapy exercise program. They only end up requiring surgery. So some of the measures taken to counter osteoarthritis are: number one, lifestyle modification. We advise the patient not to climb stairs or squat on the floor, because while you climb stairs, the stress that goes to the knee is about 4 to 5 times the body weight of the patient, because it's not only the body weight, it is also the muscle action that's happening across the knee joint, which gets added as a stress to the knee. Similarly, when you squat on the floor, about 4 to 5 times the body weight again goes through the knee. So avoiding or minimizing those will really help. In a similar manner, losing weight, if you're on the higher side, also will help, because 1 kg decrease in body weight can will reduce about 5 kg of stress going through the knee while the patient is climbing stairs. The next group is the exercises. Types of exercise that can be done are walking. Cycling is a very good exercise. Then swimming and yoga. So what it does is basically it strengthens the muscle around the joint. It improves the mobility of the joint, and also it decreases the pain sensation. So in a way, minimizing the requirement for analgesics or painkillers. And how it does is that whenever the muscles around the joint are strengthened, it gives stability to the joint. And a stable joint is usually not prone to injury. So third group is medicines. Usually we advise some kind of topical analgesic ointments, sometimes analgesic tablets like simple paracetamol may be required at times. Another group is the nutraceuticals, glucosamine, for example. They have been used for a long period now, and do not really know whether they work very well, but at least they work to some extent. Probably it could be because of a placebo effect, but at least they do not have that much of a significant side effect, so they can be prescribed. Then another group is the joint injections, the visco supplements, for example, hyaluronic acid injections. And again, these are very expensive, and how far they work, we really do not know. And my personal practice, I do not advise people, but sometimes people come with injections in their hand and they want me to inject. Of course, it's a different scenario. So, but if you go by the American Association of Rheumatological Society, these are no more in the indicated list, in the recommended list. So another group is the braces, the knee braces, orthotics. How it helps is that you see many of the patients who have osteoarthritis, they would have in one compartment of the knee, usually the medial or the inner compartment of the knee. While the outer compartment will be disease free. So what the brace does is it redirects the forces which passes now through the healthy cartilage rather than the diseased cartilage. So that way also pain can be relieved. So most of the patients are going to respond to this kind of physical therapies or a combination of these, some of these. Only a few percent of patient is who doesn't respond to this kind of physical therapies after a fair trial, after a fair amount of time. Only those end up requiring surgery. Now, there are myriad of surgeries available, all according to the case of the patient, but the most widely practiced one would be probably total knee replacement of the knee joint. Although it's extensive surgery, but it's still a very successful, highly successful surgery. The patient satisfaction rate is about 95%, and it requires a hospital stay of about 3 to 4 days and surgical time of about 1.5 hours. Patient can almost immediately start bearing weight and walking after the surgery. Um, After a good rehabilitation program, you'll be able to cycle and even play some low contact sports like golf or even tennis. So again, I would like to reiterate that the vast majority of the patients with osteoarthritis are going to benefit from physical therapy. So give a fair trial and follow a healthy lifestyle. Try to lose weight if possible, and do your exercises. Probably you'll get better with these measures alone. So now we move on to another scenario. This time, adult male in his 30s would come complaining about a low backache, which get worse on, say, bending forward or lifting weights. There will be a history of similar episodes in the past as well. And very often you'll be carrying MRI with him, which shows disc bulge. Now, this disc bulge actually are not very significant because even if a person who never had backache in his life, even he can show disc bulge. So, in the most likely cause in this scenario may not be a slip disc as one would like to assume, but it could be just that inactivity or because of some improper posture or just sedentary lifestyle. So what I would like to suggest is that you first of all stop bending and lifting for a while. Not that you won't be able to do it for the rest of your life. Once you build up your muscles, you will be able to do whatever you used to do before you had the pain for the first time. And then use a low pillow and a hard bed and maintain proper posture and do your exercises. Now, but just that they are smaller in size. So those also need the support. Now the muscles at the back, the erector spinae and the abdominal muscles in the front, they give support to the spinal column. So once you build up these muscles, they bring stability to the spinal column. And very often after doing these exercises, strengthening your muscles, pain would very often go off itself. Um, just adding a few more lines to the posture thing because nowadays we get to see a lot of patients who have who need to sit a long time of the day spent they have to spend sitting because of their work needs. So they must know how to organize their workplace so that it doesn't put a stress on the back. So some of the measures are number one, you try to get hold of a chair with adjustable. Make sure that your legs are not dangling. It reaches the floor. If it doesn't, then you can put a pedestal there so that your foot comes to rest on the pedestal. The idea is that the weight of the lower limb should not be dragging onto your back. And next is try to keep your spine as much straight as possible. Um, the spine, if you look from the front, it looks like a straight line, but if you look from the side, it has got curves, two forward curves and one in the neck and one at the lower back, and there's a backward curve in between. So try to maintain this curve and maintain a straight spine. You can put a pillow behind your lower back to support your spine. Then the upper limbs, try they should be resting on the side rests with the elbow nicely flexed at around 90 to 100 degrees. Again, idea is that the weight of the upper limb should not be dragging onto your cervical spine. And then try to keep the screen at the arm's distance, and the top of the computer screen should be lying at the level of your eye so that you need not bend your neck too far to look at the screen. So all this, having said about the proper posture, what is also important is that even if you maintain this posture, you cannot continue for a long period of time in the same posture. So after every 1 hour or say 45 minutes, try take a break of about 5 minutes. What you can do is whenever a phone call comes, you can go and walk around, take the call, walking around, or say go and have a glass of water. Just make sure that the water source is good, away from your table so that you get a few minutes to walk around. So with these simple measures, your backache can be managed, and if you observe all these problems, whether it's osteoarthritis, whether it's osteoporosis, or this backache, the common thing or common solution is activity. So always try to maintain a good, healthy lifestyle. Keep a proper posture, maintain a good balanced diet, and do exercises regularly. So keep active, keep moving, and keep walking. So we can see some questions have come up. Can we take those now? Yeah, so Preeti asked, she has got shoulder pain and difficulty in mobilizing the shoulder and to comb her hair in the morning. What could be the cause? Well, there are a lot of causes that can cause pain in the shoulder or in and around the shoulder. It could be a bursa that has got inflamed, resulting in bursitis. It could be a tendon that has got irritated, causing tendonitis, or it could be a frozen shoulder. In her case, most likely, we could assume it could be a case of frozen shoulder. Well, it is a self-limiting disease actually. What happens is that the shoulder joint has a capsule that gets contracted and thickened, and it doesn't allow for mobility of the joint and becomes painful. So even if you do not do anything, time will come when it will go off on itself. But that may take around 2 to 3 years. So you can't wait that long. So first thing, one of the things you can do is apply some ice pick over the area. That will bring down the inflammation. But when you apply the ice pick, you make sure that you're not applying the ice directly over the skin. Wrap it in a towel and put it for around 10 minutes or 15 minutes, 2 to 3 times a day. And they'll try to bring down the inflammation. And then you need to mobilize the joint. You need to stretch the capsule and also strengthen the muscles. Uh, some of the patients will, of course, get better with just the simple measures and few analgesics like simple paracetamol. But there would be a set of patients who is not going to improve with this alone. They may eventually need a steroid injection in the shoulder joint. But of course, you have to make sure that she doesn't have any contraindication for steroid use, or make sure that this is administered in a sterile way in a OT environment. Parthav says, I feel a sharp pain in my heel. What should I do and why does it happen? Is it because of my footwear? Well, footwear may be a cause of a lot of foot pain because it shouldn't be a cramped one. Better not to wear one which is pointed. There should be enough space for your fingers to spread, and make sure that the sole is supported very well. So proper footwear is very important, but when he feels the pain only in his heel, then probably it could be because of a condition called plantar fasciitis. So what happens is that what could happen to him, I presume, is that when he wakes up in the morning and puts his foot down, it takes the first step is the most painful one. Then once he walks for a while, the pain usually lightens up. Again, same thing happens when he stands up from sitting position or he stands for a long period of time. So what he needs to do is stop walking barefooted and use some silicone heel supports, and just to make sure that it wears both the sides because we want the foot to be at the same level all the time. And you can do some stretching. One way of doing it is by taking a tennis ball, for example, and putting it in under your foot and rolling it over and over for about 5 to 10 minutes morning and evening. And of course, you can apply some ice pick as well. That will also bring down the inflammation. Some patients are going to respond to these therapies alone, and rest of the patients again might require a steroid injection, as I told you, after getting excluding the contraindications and in a sterile environment. Swati wants to know what are the signs and symptoms of calcium deficiency, how to spot osteoporosis early. Well, osteoporosis may be very difficult to diagnose because patient may not have any complaint as such. So that's why we say that when people who are likely to have osteoporosis, they should get tested. For example, women of around 50 years, post-menopausal women, they lose a lot of bone mass because of the hormonal imbalance. So they need to routinely do a test of around, if you're around 50, I don't know your age, but if you're around 50 or 45, and even nowadays we see a lot of early menopause, it starts around 40. So if you have early menopause, that's even is a bigger indication for doing a DEXA scan. So I presume if you have these aches and pains all over the body and without to have about osteoporosis, doubt about osteoporosis, then get yourself a DEXA scan done. Prabal wants to know what is the appropriate age for total knee replacement. It's different for gents and ladies. Well, total knee replacement, as we have discussed earlier, is it should be done. It should be done around the age where, in such a way that the patient doesn't require a change of the artificial joint in his lifetime again, because these are expensive operations, and the artificial joints also have a lifetime result, so it would last say around 20-25 years. So it should be timed in such a way that the patient wouldn't require it in his lifetime again. So the consensus is about 60 years or so, but there are certain situations where we may have to do joint replacements a little earlier also, depending on the situation. But if we have to do it earlier, then probably he'll require a second operation in his lifetime. But nowadays, again, there's a revision surgeries. It used to be a bit of a problem in early days, but now more and more revision surgeries has been done and has been successfully done. So if required, yes, it can be done before also, but the ideal age would be around 60 years, I would say. Okay, tell about a little bit about Department Apollo Excelcare. Okay, we are here in Apollo Excelcare. We are three of us, orthopedic surgeons, me, Dr. Abhay, and Dr. Parag. So we are regularly doing these joint replacements, and besides our trauma cases, we're doing pelvic surgeries. Even today we had one pelvic surgery here. So yes, all the routine things, arthroscopy is done, and pediatric orthopedics, every discipline of orthopedics has been taken care of here.